Child first aid, what to do when they get hurt. When a child gets hurt, knowing what to do can make a big difference in helping them feel better and preventing more serious problems. First, always make sure the environment around the child is safe for both of you. Check if the child is awake, breathing normally, and responsive. If they are unresponsive or not breathing, call emergency services immediately and start CPR if you are trained to do so. For minor injuries like scrapes, cuts, or bruises, wash your hands thoroughly before touching the wound. Apply gentle pressure with a clean cloth to stop bleeding, holding it for about 5 to 10 minutes. Once the bleeding slows, clean the wound with water or a gentle antiseptic solution to remove dirt. After cleaning, if you have an antibiotic ointment, apply a small amount and cover it with a sterile bandage. Elevate the injured area above the heart level if possible to help reduce swelling and bleeding. Keep an eye on the wound for signs of infection, such as redness, swelling, or pus. If your child has a burn, immediately cool the area with cool running water for 10 to 20 minutes. Do not use ice or greasy creams. Cover the burn with a clean, non-stick dressing or cloth. Seek medical help if the burn is large, deep, or involves sensitive areas like the face, hands, feet, or genitals. When dealing with head injuries, keep the child calm and still. Watch for symptoms like dizziness, vomiting, confusion, excessive sleepiness, or loss of consciousness. If any of these occur, get medical help right away. Do not press on the head or try to remove objects stuck in a wound. For injuries involving bones, joints, or muscles, like sprains or fractures, follow the R.I.C.E method. Rest the injured part, ice it to reduce swelling, compress with an elastic bandage, and elevate the limb above the heart. Avoid moving the limb if you suspect a fracture and seek professional medical evaluation as soon as possible. If your child is choking and coughing forcefully, encourage them to keep coughing. If they cannot breathe, speak, or turn blue, perform back blows and chest thrusts for infants or abdominal thrusts for older children. Call emergency services immediately if the airway remains blocked. In case of allergic reactions, identify if your child has been exposed to allergens like bee stings or certain foods. If they have an allergy medication or epinephrine auto-injector, use it as prescribed. Call emergency services if they have trouble breathing, swelling of the face or throat, or lose consciousness. Always call emergency services if the child is unconscious, not breathing, bleeding heavily that does not stop, or if there is suspected poisoning or a serious burn or head injury. Seizures or persistent vomiting also requiring urgent medical attention. If you are unsure about the severity, it is best to seek professional help. For unresponsive children who are not breathing or only gasping, start CPR immediately. Use 1 or 2 hands to press down about 2 inches deep at a rate of at least 100 compressions per minute. For infants, use 2 fingers to press about 1.5 inches deep. After 30 compressions, give to rescue breaths by tilting the head back slightly and sealing your mouth over theirs. Continue the cycle of 30 compressions and 2 breaths until help arrives or the child recovers. Having a well-stocked first aid kit at home is very helpful. Regularly update your skills through certified first aid and CPR courses. Always stay calm and reassure your child to help reduce their fear. Remember to document what happened and the first aid you provided, as this information can be useful for healthcare professionals later. Knowing basic first aid tailored for children can help you act confidently and effectively in emergencies. Every injury is different, and some situations may need professional medical care. When in doubt, always seek advice from healthcare providers to ensure your child's safety and health.